Signs and symptoms of skin cancer. Skin cancer, the abnormal growth of skin cells, most often develops on skin exposed to the sun. It's commonly found on your face, chest, arms, and hands. Skin cancer can also develop on less exposed areas of your body, such as these locations: scalp, ears, lips, neck, under your fingernails, bottoms of your feet, genitals. There are three major types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. You can reduce your risk of skin cancer by limiting or avoiding exposure to ultraviolet (UV) radiation. Checking your skin for suspicious changes can help detect skin cancer at its earliest stages. Early detection of skin cancer gives you the greatest chance for successful skin cancer treatment. Skin cancers often appear as a suspicious mole, freckle, or spot. But accompanying symptoms depend on the type of skin cancer. In this video we talk 9 signs and symptoms of skin cancer. So keep watching until the end. 1. Asymmetrical moles. Asymmetrical moles with irregular borders may be a symptom of melanoma. Though not the most common type of skin cancer, melanoma is the most serious. It not only affects the skin, but can also affect the eyes, the palms of the hands, and the fingernail beds. Women often develop melanomas on the lower legs, while men tend to see them on the chest, back, head, and neck. Moles that change in size, color, or shape can indicate skin cancer. A mole that bleeds, itches, or changes in any way needs evaluation to rule out melanoma. A normal mole is about a 1/4 inch in diameter, the size of a pea. Moles that grow larger warrant medical investigation. Doctors are seeing many more cases of this type of skin cancer in people under 40. 2. Itchy skin. Itchy skin can also be a warning sign to pay attention to. Itchiness isn't always present, but skin will generally become redder and raised. Basal cell carcinoma can also present as a pink growth that is raised around the edges but flat in the center. With this type, abnormal blood vessels may extend out from the growth. One of the most telling and alarming signs of basal cell carcinoma is an open sore that doesn't go away. It will ooze and crust but not heal. On the chance it does clear up, it will eventually return. 3. Melanoma. While melanoma isn't the most common type of skin cancer, it's the most serious. It frequently develops on the legs of women and on the chest, back, head, and neck of men. However, this type of skin cancer can be found anywhere on your body, even in your eye. 4. Bumps or lesions. A pink, white, or skin-colored bump or lesion that appears on the face, ears, or neck may be a sign of basal cell carcinoma. The lesion may have a waxy appearance or be flat, red, and scaly. Some become irritated, bleed, and then scab over, and they may itch or hurt. This type of skin cancer begins in the basal cells, which are responsible for creating new skin cells after the old ones die. Less severe than melanoma, basal cell carcinomas seldom spread to vital organs, but they can cause nerve or muscle injury and disfigurement if not treated. About 8 out of 10 skin cancers are of the basal cell type. 5. Open sores and growths. A persistent red sore, nodule, or scaly patch could be squamous cell carcinoma. The growths have a crusty exterior and often appear on areas that experience frequent sun exposure. Squamous cell carcinoma can develop on any area of the body, including the genitals, though the most likely places are a balding scalp, or the neck, hands, arms, or face. They may also appear on the rim of the ear or the lower lip. Over the last 3 decades, the number of squamous cell carcinoma diagnoses has increased by more than 200%. 6. New moles. Moles are a concentration of melanocytes or pigment-producing cells on the skin. Most are benign, with colors ranging from dark brown to shades of pink. The average adult has between 10 and 45 moles on their body, which usually develop before the age of 50. Those with more than 100 moles are at greater risk for melanoma. It is important not to ignore new moles that appear on adult skin because they are more likely to be cancerous. New growths or lesions on the skin may also be a sign of skin cancer. These types of growths could also be precancerous lesions that may become cancer over time. 7. Dark spot on palms or soles of feet. Acral lentiginous melanoma is a type of cancer that develops on the palms of the hands, nail beds, or soles of the feet. This melanoma is darker than the skin around it and starts out as a small spot that looks like a bruise or stain. It may be tan, gray, brown, or black. Occasionally, the spot may be red or orange, but the border around the spot is usually clearly defined. Researchers believe this type of melanoma skin cancer is genetic and not related to sun exposure. Acral lentiginous melanoma is more common in people of African and Asian descent. It often goes unnoticed and misdiagnosed, but is more aggressive than other forms of melanoma, and prompt diagnosis and treatment is essential. 8. Pigmented patches, edema, or bumps. The most common sign of skin cancer is a change on the skin. New patches resembling a mole may not be a mole at all, but a melanoma. The edges of a problematic patch will likely be less defined and appear more ragged. The coloring may be uneven, usually in varying shades of brown, tan, white, black, or blue. Normal moles are mostly symmetrical, while skin cancer patches are asymmetrical. Always check existing moles regularly for changes and do monthly skin exams to look for new moles or skin lesions. 9. Bumps on the eyelid. The eyelid is especially vulnerable to the harmful UV rays of the sun. Between 5 and 10% of all skin cancers develop on the eyelids, with the majority occurring on the lower lid. Most are basal cell carcinomas, which are slow-growing. Squamous cell cancers, malignant melanomas, and sebaceous gland carcinomas can also appear on the eye area but are less common. Smooth, shiny bumps that are firm or red are a skin cancer symptom. Styes, nodules, swelling of the eyelid, or lesions that grow, bleed, or do not heal can also indicate the disease. In some cases, the eyelashes fall off. Thank you for watching. If you enjoyed this video, hit like, share and make sure to subscribe, Health Tutor, because more incredible content on the way.